Yeah, but I think I'm gonna need cops on this one, so.
I never seen it.
Yeah. It's in,
Solution that I was researching.
we hit it and went, and it was only
I was
six
gonna
minutes.
say, I thought it was gonna be easy to find emails.
Only three of them got names. One was a kid, a new kid. So it wasn't about banging on the doors. And that's just smart, like, I'm working on this.
He seems like a nice guy.
But I'm gonna go to police and take it. I'll let you know. I should have that.
So I just, I'm like, yeah, I
We're
think
just
we
moving
take
stuff
together.
around.
Yeah, no, so this kid, he used to operate on 9 cents a week, but he got shut down.
For some reason, I
Said something taken away from the reception. Will you, the guy called doctor a long time ago? 9 Central Street, where, I forget what else was in that building. Either way, he operated on the fourth floor, now they're turning it. So check that out.
Waste of time.
I'm gonna go to the police and see if they can pull a couple of strings, just to get me into the building, so I'm not on six days.
How are you? Is he gay? I thought that. Let's see the picture.
We're not even pictures.
No. So they.
I only have a stupid one they took on my line. I'll give you a rough.
Are they still here? They let you know.
So then you guys get her done.
Oh, they used to be here.
Yeah, she was looking for a new, like, a new book for her to town. It's a sign.
That's why did I text you about that? It was free.
Since she was here working.
If you wanna call me, come.
You guys really-
He's got big eyes. So where do they live now then?
They work in an apartment. Oh, yeah. Like, where's my wife?
That'll slow down. Which is the baby Yo, what color is his hair?
Dark. It's dark, it's
But
dark.
his dad has really dark hair.
Yeah, you should show you pictures of his dad.
His dad's really dark.
Yes, dad, he's Italian, so.
Oh, jeez. So I come back and I send the crew, he's on the bar, and
Oh, you know the pictures.
I made a big small
So, that's a picture of his father and his baby.
Oh, wow.
So you look at the picture of his kid,
Yeah.
it looks just like his father. No, no, like, look at it.
Oh, he's so dark. He does have the eyes.
Anyway, that's my boy.
Oh, that's exciting. Hi. How are you? Let me see. So cute, right?
She looks like a pumpkin. He was born.
You know what, maybe it's your
What was your
I know, he was born in February.
making us nervous. I know. Oh, I know, I was just saying the other day.
I mean, it's just expired.
No, this is past, yeah. But it's not ours.
Oh, okay, okay,
It's a supermarket, yeah. No one makes it.
Scared me.
It's 6,
Can I move for a second?
probably half the size of the stable.
So Erin, send me that stuff if you can.
I know. Nothing like me saying this to you and blowing up. I need to get it. We're basically just grooming a replacement. That's
Yeah.
You know, she's right.
We're grooming. I call the meeting of the Board of Health of March 4th to order. First item on the agenda are acceptance of the minutes of the February 4th meeting. Do we have a motion to accept?
Motion to accept?
Second? Thank you. Those in favor? Aye. The next item on the agenda is the Development Services Report submitted by Matt Sheehan.
Hello, everybody.
Hi.
This reporting period, well, I should say, the shelter, up to date. Everything is all set over there from the last meeting. We had 3 restaurants expire in this reporting period. Most were for equipment issues. There were some sanitation issues in some of them. We had 1 pool inspection. I did the last tattoo shop for this reporting period, so all the tattoo shops and microblading establishments are up to date, inspected, and they all passed. And this month, the month of March, we will be in the schools doing their inspections.
Oh, boy.
So I can't stress enough, this month, the month of March, we will be in the schools doing all of the school inspections. The team went out and started today, but hey, guess what? It's half a day. So that plan just went right out the window. Other than that, that's about it.
Did you get to try the cake at Winterfest? Was it all
I-
up on the up?
I did not, but I did.
Was it safe?
I heard
I
it was
did get my selfie with Buddy Velasco. He was a wicked cool guy. There was a little thing in here.
Nice,
in the,
that's
man's
awesome.
reception room. He was fun. He was cool. Like, he was
Awesome.
really down to earth, you know. And
That's great,
yeah, he was a cool guy.
yeah.
The cake boss.
Little cake
Yeah.
boss.
And then we had the team went out. We worked Winterfest, 0 issues. Like it was good. It was very good.
How are the plans for the tattoo event?
I'll have to get back to you on that. I'll make sure I have that wrapped up and an answer for everybody at the next meeting.
When is that projected to happen?
So, right now, I'm not 100% sure, because the gentleman that did express interest in it, we kind of lost contact. But I have told, during all the inspections of the tattoo shops in the city, I told them all that this is, something that's going to come to fruition. So some of them were kind of excited about it. So hopefully word will get out. We'll see what happens.
Okay, all right. Thank you.
Thank you, everybody.
The next item on the agenda is the Pride Star monthly reports and notifications.
Good evening.
Good evening.
So the January 26th opiate report, kind of a normal winter month for us. We had, kind of that seasonal drop in Narcan save. So January 25, we had 4. January 26, we had 6. Goes spikes up dramatically in the summers. Other than that, pretty a normal report. I know last month we turned in the 15-year study. I do have copies. If anybody had any kind of questions about that, I apologize for kind of how that worked when we weren't here. Really, the highlight of that is, last year in Lowell, 41% of all overdoses, the first dose of Narcan was given by a bystander, family member, some not before 911 showed up, right? So, I mean, that's a huge number. Can't really prove it, but I think that's better than anywhere else you're really going to find. And that's, the Lowell Health Department, the co-op team, Lowell General, Riverbend, us, all that sort of stuff. It's kind of how the whole community comes together to drive that number. If you look back a few years, when we started it was 1 or 2%. It's been going up over the last decade or so. So that's a really kind of important piece of information that came from that 15-year study. So that's it kind of for opioids. Does anybody have any questions on that? All right, so if we could go to kind of the...
Do you have a question?
Specifically? Oh, all right, cool. All right, I apologize. So if we go to kind of page 4, which is really where the data starts, again, we had another quarter without needing outside mutual aid, so now it's been over 2 full calendar years since we needed Tewksbury Fire, Wilmington, or something, not Wilmington, but Westford to come in. Again, that's kind of a unique thing locally and even nationwide. It's just not something that really happens that much anymore. We did meet the performance requirement at 90.8%, so we were over that. On 3 different occasions last quarter, we had at least 9 ambulances on 911 calls or on emergencies at the same time. If you go to that page 5, it's kind of a map of that. I know there's a lot going on, but this is that Genesis Pulse program. We haven't talked about it in a few years, but basically every ambulance's location, so it's the hospital medics and ourselves, every ambulance, every 10 seconds, the location is recorded, and then it's stored forever. So if the board had a question on, January 3rd, 2021, what happened at 9 a.m., we could reproduce and show where all the ambulances were and show kind of where all those calls were. So that was a really busy period. That was kind of part of that concurrent on-contract, non-contract we've been working on. This was kind of the most we've seen since we started that process. We had 10 emergency requests in the city at the same time. And there was actually an 11th one that came in as well, but it was out of SNF, so we were able to, we EMD'd that ourselves, so we were able to kind of delay that care a little bit because the patient was low acuity and had medical care for them. So you can kind of look around and you can see where all those emergencies were at that same time. So again, no need for outside mutual aid.
Right, so you don't routinely have 10 trucks though, right? Or do you always have 10 trucks, so you had 10 trucks to respond?
We did have 10 trucks to respond at that time, yeah. So that's the benefit really of the Trinity and Pride Star coming together.
Right.
Right, so we have, the contract is, I think it's 4 911 trucks dedicated.
Yep.
Trinity, well, on the Dave, I hope you didn't hear that. On the 911 side, we
Oh, yes,
have-
he did.
I know, he probably did. We always have what we call BAM. We always have 6. And then we have all the IFT trucks around that help, do calls for Lowell General.
Right.
So basically what happens is you have those 6 that we have for 911, and as more calls come in, we start like, okay, let's delay that call for a few minutes. If you look at the top of the map, you can see B11. That was one of what we call a Bravo ambulance. That's kind of newer people, so we kind of give them IFT only until something else comes in. But on that call, we ended up sending them on the one downtown with our S2 vehicle, which is our supervisor, responded with them to make sure we didn't have any kind of issues or anything. So yeah, so we have, the city trucks, we have IFT trucks, and we blend them together and we kind of go around. And that's really the benefit of the 2 organizations coming together is kind of that ability.
What is IFT?
Interfacility transfer, so the stuff out of the hospital or kind of like stuff out of the nursing homes.
Sure, thank you.
And in this instance, we were able to pull, because we have Draken and Chelmsford, right, that's kind of the benefit of the system. If you look at the top of the map, you can see kind of A6 on that ER status, they're en route. So they're going, that's one of our Draken ambulances, so we can pull the mutual aid into Lowell to help out. So again, we can kind of keep that in our own network. That's kind of the big one. And those 10 don't include, those 11 don't include the Lowell General Medics. They were on calls as well, but that's not part of that number because technically it's the same call, right? So their 2 paramedic trucks were on those calls with us. We have 3, I think it was 3 IFT ALS trucks that were also responding on calls as well. And then if we go to page 8 real quick, just for clarification, so these are the over 12 minutes. I know we want to kind of highlight those each time. The P2 transport, that means priority 2. I know we've talked about it. We'll stop putting priority 2 because I don't want there to be some confusion with, we have P1 in town and then P2 up the road. So I apologize if that's kind of confused people, but we'll start spelling out priority. So we had 5 instances where the patient went, so it took more than 12 minutes to get to the patient, and it went ALS to the hospital. So 3 of those patients were kind of almost accidental ALS. We sent our paramedic truck. Somebody's dehydrated. They get an IV, right? 2 of them went Lowell General paramedics to the hospital. That took more than 12 minutes. Again, none of them went, none of them were RSI, none of them got CPAP, none of them were intubated. So they weren't, really those critically ill patients, but we do want to make sure we highlight those instances. And then really the only other thing I had on page 11, yeah, I know we've kind of been looking at this over the years, the percentage of ALS calls done by Lowell General versus us. It's kind of trickled up a little bit over the last few years with kind of staffing challenges we've all had in EMS. The Lowell General system has been doing a great job kind of revamping their per diems and their full-timers. So I think what you're going to start to see is that number of, the percentages of ALS done in the city by Lowell General will start to go back up to its kind of historic levels. And then I'll stop talking in 1 second. On page 15.
Before you jump there, Tracy, what is the current, how many open spots do you have for the paramedics?
We have enough that we're concurrently staffing 2 trucks 24/7.
Fulfilling the obligation, no short staffing at all?
Yep.
Okay, thanks.
Yep.
Yeah, it's been wonderful the last couple of months. And then on page 15, kind of to highlight, kind of continuing on the staffing, we've been hiring a bunch of people. We currently have 5 EMT programs that we're managing. And, we're trying to hire as many of them can into the system. We've got is it 2 or 3 in Lowell, Dave?
3.
3 in Lowell, and then 1 in Wilmington and 1 down in Marlboro. So, you know, we keep kind of trying to boost those numbers as much as we can, not only for us, but for, you know, the police and the fire departments that are around trying to desperately hire people as well.
You didn't mention, but great intubation numbers, et cetera, too, by the way, thank you.
Yeah, Lowell General, fantastic at that as normal.
That's the iOS, right?
Can I just, I had a question going back to the 40%, not on this report, but I think you mentioned the 15-year report.
Yep.
Did you say 40% of the Narcan administered was by a bystander?
40, so does anybody need I have copies if anybody wants it.
I would.
Yeah, so.
I wasn't at the last meeting, but
I don't remember seeing this.
Thank you.
I wasn't here.
So it's on the back, I guess they don't really look any different, but if you look at the top, the 2021, 2025, it's down on the left-hand side, yeah, so for 2025, we have documented instances, 41% of the time that a patient needed Narcan, the first dose was given by a bystander or family member. Last year was, 2024 was 44%, but if you kind of go back to the left side of that, 2016 it was 10%, it kind of ramped up, and that's kind of that whole community involvement and taking ownership of things.
yeah, I mean, I think this number is very important when we, we're talking about clean needles and safe injection sites. And I think this points to the fact that, I mean, it's one of the reasons I don't think we need safe injection sites is because we have clean needles available and we have Narcan available. And you have to be able to show that you have Narcan available in your community. And this number, I think is a good point in terms of saying, yes, Narcan's available.
Yeah, absolutely. It's hard to imagine a community doing a better job in Massachusetts than Lowell does. I don't know if we could get the numbers from DPH, but I mean, 41% it's a very high number, and again, it's a decade of relentless work.
Yeah. Thank you.
Sure.
Thank you.
All right, have a good night.
Have a good one, guys.
Thank you.
It's pretty amazing.
Could we get the numbers from DBH?
So it's not actually the number that's used because no one does statistics like John does, and he reports out at Mary and Ryan's DH task force. But the BSAS dashboard, so the Bureau of Substance Abuse, tells how many doses of Narcan are given out to each community, but not how many are used in each community. So I don't think that anybody actually says how many are used in each community. So John is the only one that reports out for the whole Merrimack Valley, I think.
You gotta show these data to them so they know, hey, that's what we should be looking at.
Right. So, but you can see how much is given out by the DA for each community.
Right.
I
Which-
mean,
yeah.
the number alone speaks, it would be nice to see other communities, but this number alone speaks to Lowell, and,
Correct.
yeah.
But John speaks probably once a quarter at the DA's task force, so, and if I'm on a call, and it's a different type of a call, like the 14 biggest cities, like so I think a couple of you are going to the MAHB, they could call you guys out and say, Lowell does things, and Lowell does things better than everybody else, so watch out, you might get called out. Because of John. Thank you.
Yes,
No,
thank
you, the data keeping. You started data keeping, and then we follow with a lot of other things, so thank you.
John the Data King.
Donna,
Have a good night.
John is a data king, yes, so, thank you.
Next item on the agenda for approval is the body art apprentice license, tattoo only,
Yes,
for apprentice at Black Sheep Inc., Dutton Street, Lowell. All the paperwork is in order, correct?
yes, everything, I have it all here, everything is in order for this girl, Maria,
Maria Astudillo.
correct.
Do we have a motion to approve the body art?
Quick question. I make an assumption that if it's for microblading, there's somebody there. Just generally speaking, if she's gonna work at a place that's microblading, that there's somebody there that has microblading.
Right, but this one
privilege
is,
here, who's allowed to do that here.
right, this one is, I don't know why this says microblading, because this one's only doing
Tattoo.
tattoo.
Oh, that, well, it's
So-
blank, it's just on the same sheet, it's not checked, but.
Right.
But generally speaking,
Right.
you can't be an apprentice for something that there's somebody not licensed on that premises to do,
Correct,
right?
correct, right. And we'll review that next month, because Matt will be talking about something next month, so we'll be reviewing that next month. Right. Did we have a vote to
We have
I'm
approve it?
sorry, I'll make the motion, sure.
Okay.
Second?
Who seconded? Okay.
She didn't second.
No.
And,
I was asking for a second.
okay. And a vote, Joanne?
Yes.
Bill?
Yep.
Erin?
Yes.
Kathleen?
Yeah.
And Ally? Thank you.
I do have one, the vaccination status for their hepatitis B, I mean, not that, what was the other one? Bloodborne pathogens, looks like it's gonna expire. When does this, how long is this certification for this?
So I believe it's a 2-year certification.
That will expire. in
Same with
November.
BLS.
I'll,
That will be
And the
talking about next
BLS.
month.
correct. So she'll have to get these, done. So what probably happened was she was probably a tattoo artist somewhere else who had these, but she probably did not practice in the state of Massachusetts. So she's probably just starting in Massachusetts is probably what it is. So, yep.
So she won't wait 2 years to get those done, they'll be done.
No, she's yeah.
Hep B, she's done.
No, I'm sorry, I said Hep B accidentally at first, but the bloodborne pathogen certificate and the.
Oh, yeah. Those
Expires 11/10 of '26, right? And then basic first aid, correct.
Yeah.
Yep.
Next item on the agenda is the monthly tobacco control, the Central Mass Mosquito Project update, budget for next year for contract for mosquito control. Any questions?
A lot of money.
Killing bugs.
Right. But I think the last couple of years, more residents have picked up on using it, and we've had, I believe last year was 5 mosquitoes, the year before were 3, so we've done more spraying than we usually have, and I believe multiple other communities have, so that's probably why the increase.
Thank you for that clarification,
You're welcome.
Health Director.
Thank you, Madam Director. The next item is the monthly tobacco control report.
Move to accept.
So there was one thing here on the tobacco report, sorry. So just so you know, Caesar will come probably next month because there's concerns of non-tobacco products. There's a new thing out there.
There's
Nit-
always a new thing out
I
there.
know, nitrous oxide, laughing gas.
It's not new.
That's not new.
There's like little whippets.
You didn't do that?
It's not new. You can do that whipped cream. You get whipped cream. Has
No, it's not just that, it's not just huffing. They're selling these little whippets.
Yeah, oh, that's been around for a long while.
Yeah, so, yeah, like poppers and things, so. And then they're also selling something else that he's gonna come.
And are they being sold as inhalants, like to actually use them to inhale?
Yeah,
In tobacco stores?
in tobacco
In those
stores, yeah.
tobacco.
So there's a House bill that, they're trying to ban them.
All right.
So I think that, it's probably just a matter of time before the council asks the board to write a letter of support for the bill. Just a heads up.
Just an update on Kratom. There's now 20 cities and towns and 4 more scheduled to ban this week.
Say it again, I'm sorry.
Yes.
An update on Kratom. So there's now 20 cities and towns that have officially banned, and there's 4 more scheduled to ban this week. And then the House bills are still moving through. So.
Which is very good because I was on a call today that the DEA was on, and they've actually, so you know how it was just like 1 or 2 names? They've actually branched off and they have multiple other names that they're calling it, and it's become more deadly.
Oh, nice.
Sure, if you're gonna make a product, let's make it more deadly, not safe.
Exactly.
Next item on the agenda is the Cashins and Associates Air Quality Report at LHS.
Would you accept that too, or is that just a FYI?
FYI. Any questions? Looks good. I mean, the issues that are close are always at the wall, wherever the division is to Okay, no questions?
I am.
Move to the departmental division reports, Public Health Division report.
I know.
So the first one is the public health and epidemiology report, and I believe that it was asked last month about the vaccination rates for flu and COVID from last season, so Gisela did add that on here. So this season, actually, people are still getting vaccinated against flu, so I think we're up to 32%, and last season was 37%. So we are lower this year for flu and COVID.
So those numbers come from Maven?
The numbers come from the state. So they come from the state.
For the record, the hospital is dropping its masking policy at the end of the week and considering the flu season
Yeah.
basically done.
Yeah, the numbers have dropped dramatically. We're seeing a little bit of flu B, but
Good.
not really much. So the numbers have dropped.
It looks like the hepatitis B numbers are running about the same as last year.
Yeah. More people are being tested because in the hospital, if people have a higher increased liver rates, so some of the labs, if they're higher, they'll automatically be tested for a hepatitis panel. So more people are being tested for hepatitis A, B, and C. So I believe that's why our numbers are running higher.
I thought it was encouraging that in the community education and outreach, that staff members attended the Merkland School Open House and shared information on childhood vaccines, encouraging children to get vaccinated.
Yes, there is a lot of information being taken from the tables. We do have a lot of gadgets to give, and it draws people to the table, and then they give out the information as well. So we get them in, and then, Haley is out there and being invited to a lot of open houses. There is one coming up at Lowell High soon as well, so, which is great because Massachusetts just had their first 2 cases of measles, so it's good that that's out there. The school nurses had a meeting today, so Hope did talk to them about being aware of the students who are not vaccinated, so that the nurses will be aware if there's a case in their schools, but the vaccination rates are still pretty even to what they've been for the last couple of years, so Massachusetts is doing a good job with vaccines. I think it's just the younger age children, so that's where the rates are, and people are waiting when they're looking for an appointment. We did start carrying vaccines for adults. We're not a VFC provider, so we have started giving MMR, tetanus, varicella, polio to adults, and we have had a lot of Middlesex students, people going for CNA or nursing programs that can't get vaccines, or people coming in who need vaccines for immigration paperwork or things like that. So we're giving out some vaccines. Not a lot. I mean, I'd say about 10 in a month or so. So we're giving out some vaccines for people who need them and can't get to a physician practice. So we do have some vaccine on hand for uninsured people.
What is the syndromic surveillance
Yeah, I
conference?
was wondering what that was.
Where did you?
Gisela attended a syndromic.
What did she write? Where is
I've
it?
heard before. It's like the last page.
The last page.
Oh,
Gisela
a
attended.
surveillance conference.
Yeah.
I think it was just like a tell-all about surveillance. So what she does is she does surveillance for all 90 diseases. So I think it was just kind of like a mixed bag of everything, I think is what it was, yes.
Surveillance stuff.
Yeah, so I think it was just a mixed bag conference about everything. I think that's what it was. Okay, so that was that one. So Hope did her report a little bit different for you guys because she had been just giving you numbers for the school health unit. So she gave you a comparison from last year, this year, and a year-to-date comparison, just so you guys would have some numbers for her. And then Do I have substance? Yeah. Oh, maybe I don't have the substance abuse. Did you guys get substance abuse?
Yeah.
There was one,
Okay,
yeah.
okay, I don't have it in the packet. And then Andres's needles were a little bit separate, and I think last time there was a question about when he had his year-high numbers. And his numbers from last year, the pickup requests were about 1,500 higher than they were the year before. And then his email requests were double what they were last year. So when he had his program highs, there was a question about that. The other numbers weren't really that much higher than his program highs had been.
Was he on vacation in February? Because the syringes picked up in the month of January was 819, in February it was 34. Is that just because the snow?
I think what ended up happening, because it's not proactively picked up, I think the syringes picked up all discarded, picked up events. I think sometimes what happens is someone will just leave like a red container somewhere. So sometimes people just dump red containers in spots. I think that's what he ended up picking up, were like a couple of dumped containers, or people will just dump needles places, and that's what he picks up, because there was a lot of snowfall in January. I can't picture he picked up a bunch of needles, so.
Yeah, it says
But, yeah.
819.
I was just wondering why it was so much lower.
Yeah, yeah.
Right.
So I'll have to ask him about that, yeah.
Okay.
But he did, yeah, but he did have a vacation, and I don't know if it was February or January, but, yeah,
Right, January.
yeah.
I just had one question on his report. Weekly visits to 120 known encampment locations?
Yeah, so they go to,
This,
daily, they'll go to any known place that there was an encampment, just to make sure that someone's not going and putting up a tent. So they will drive to any place that there was an encampment.
it was
in the
actually
past.
120 of them?
No.
Okay.
They'll revisit each
100
place.
times, 20 times.
So say there's like 30 places that had encampments.
Okay.
They've gone there like 20 times.
Oh, okay.
Yeah, so they go there like every day, yeah. So,
Yeah, it says weekly visits to 120 known encampment locations.
yeah, so it's just that Anjali, who usually does it, is off.
Oh,
So
okay.
somebody else did the report, so it's
Okay,
a
I
little
was
bit
just looking
different,
at
yeah.
120 reference.
Yeah, it's not 120.
Location.
It's like,
it's like,
it's like
oh,
they
yeah,
went to,
120.
they went to 50 3 times.
Yeah,
Like, you know what I
okay.
mean? Yeah, I know, it's just written a different way, yeah.
Okay.
But then it makes all of us want to know how many locations are there.
Yeah, yeah. I,
Right.
yeah.
Yeah, I was like,
Yeah.
I don't think there's 100.
Yeah.
What's your address again?
Exactly. And then this Saturday is Medication Take Back Day. If anybody has pills, syringes, patches, EpiPens, inhalers, or anything that they'd like to get rid of, the Senior Center on Broadway Street, a drive-through, and we will take anything, so no residency requirements.
That's all my neighbors.
We will take it all.
Okay.
That's all I have.
Anything else? No?
Not unless you have any questions for me.
Perfect.
Any questions from the director?
Move to adjourn.
Second.
All those in favor?
Thank you.
Thank you for coming.
31, that's pretty good.
Thank you.
That was good. That's close enough.
Have a good night.
Thank you.
So the tree got cut off.
You look nice and tan, I'm jealous. Oh,
I
thanks.
know, look at her.
How's
So-
Carrie doing? She back at work?